Parents have been choosing to ask me lots of questions about whether it's okay for them to request additional tests and treatments when their healthcare provider isn't sure what's causing their child's symptoms. Well, recently the American Academy of Pediatrics released 5 evidence-based recommendations as part of a national Choosing Wisely campaign in regard to available tests that may not be indicated for all children. Recommendation number 1 is to not automatically request an antibiotic when your child has an infection. Most infections are viruses, and if your child's healthcare provider says it's a virus, antibiotics are not going to work. And too much antibiotic leads to antibiotic resistance, making it even harder for your child to fight off a serious bacterial infection should one occur. The second recommendation is not to request an over-the-counter cough and cold medicine for children under the age of 4. These have not been found to work and may carry serious side effects. Recommendations 3, 4, and 5 involve radiology or imaging studies. For example, the third recommendation is not to request a CAT scan just because it's available when your child has had a minor head injury. These rarely reveal any kind of findings, and the risk of the radiation far outweighs the benefit. The fourth recommendation is not to request skull x-rays, a CAT scan, or an MRI when your child has had a convulsion in the setting of a fever. These can be scary to have happen, but again, they don't point to brain damage, and getting an image or a CAT scan is not going to yield a finding, and again, you run the risk of the radiation. The fifth recommendation is not to request a CAT scan if your child has belly pain and your doctor or nurse are not sure what's causing it. If that's the case, your doctor will do a careful history and physical examination, and if they can't localize what's causing the pain, don't ask for that CAT scan, again, because the risks outweigh the benefit. Does this mean your healthcare provider is not interested in your child? Well, no. It's just the opposite. They're going to be even more interested because they're not ordering these tests and treatments. So that hopefully, tips like this will allow you and your child's healthcare provider to choose more wisely when it comes to recognizing that not all the available tests are going to be indicated. This is Pediatrician Dr. Lewis First from Vermont Children's Hospital of Fletcher, Allen, reminding you to always be first with your kids. Think your child needs some antibiotics or a CAT scan for what's bothering them? Well, think again. The data says otherwise. Stay tuned. First with Kids is coming up next.